We've talked about coronavirus for weeks and weeks and weeks. The other day, I listened to a fantastic interview by an Australian woman, an expat now living in Singapore, an associate professor at a university, and she has been involved in isolating a component of a person who was infected with COVID-19 a number of months ago. That has created a test that has been critically important in Singapore, being able to test positive and then contact trace anyone who has had contact with a person testing positive with coronavirus. And as you know, we've talked about this many times, for such a dense island state and a large population, their handling of this issue has been superlative. Now, I know you've got a lot of questions. I put a sign up on my Facebook post to say, tell me your questions and I'll ask our expert. And Dr. Danielle Anderson, Professor, joins me now live from Singapore. Great to have you on the show.
Hi.
As we were talking off air, you're a Geelong girl, I'm a Geelong girl, so I'm just thrilled to have someone who's done so well leading the world in this very important area. Before I go to some questions from my viewers, Professor, tell me, what was the work you're involved in with the university in Singapore, and how has that helped Singapore, I think, handle this as a test case for the rest of the world?
So we were involved in originally isolating the virus first in Singapore. So as soon as we had patients that tested positive in Singapore, we were ready for that. And we knew that we had to isolate the virus, the same as the Doherty Institute did in Australia. And we needed that to set up our serology tests. And then also we used the virus to confirm later on whether other patients had been infected. So what we did after isolating the virus was then start to work on serology assays, which can determine who has been infected, and also what the assays are used for is to determine how vaccines would be working, essentially.
All right, let me ask you some of the questions from viewers. Graham Cook asked me, how long would it likely take for the virus to run its course and clear the body of someone who is asymptomatic? And how does the person know, this is the person who doesn't show any symptoms, that they are no longer infectious if they didn't have symptoms and they haven't been tested?
So, okay, so for the first part of the question about the duration, so what we're seeing generally is that from the people that are sick and in hospital, their disease duration is about 14 to 21 days. But also we've had people in hospital for longer than that. So these are the more severe cases. So there is quite a range of disease duration. As for the asymptomatic patients, so they're not patients, I suppose, if they're not admitted yet to a hospital, but these people, the disease duration is probably the same. And the question of how long they can be shedding the virus for, it can also be up to 14 days. But keep in mind, I think everyone's worried about the asymptomatic infection, but remember that people still have to either cough or sneeze or do something that gets the virus out of their body and onto other people.
Good point.
So,
good point.
If someone doesn't cough or sneeze, in front of you, which is where the distancing is important, then the virus won't be shed. But if they touch their mouth or their nose or something, then touch a surface, and then someone else touches that surface, this is exactly how the virus can spread. So this is why, really, if I can emphasize one thing so much, it's washing your hands.
Okay, well, this goes to a question that Sally-Ann Crane had for you. How long does the virus survive on surfaces? Does alcohol wipes, sprays, liquid, etc. actually kill it on surfaces?
So there's been reports that the virus can survive for like several hours. So one thing I do want to say, because a lot of things come in the news and from different sources, which or different, I guess, scientific journals, or before things get into journals which may not be reviewed yet. I saw a report that says that the virus can survive for 17 days, and that was on the cruise ship. And that's not entirely true. So what people can possibly be detecting is parts like the dead virus, which can still be detected. When we're talking about the live virus, it's most likely to be in the hour range, or even up to a day. So and then the question about whether the alcohol wipes and everything work. These things do work, but we have to be careful with the alcohol. That in hand sanitizers and things, the percentage of alcohol that is effective against the virus has to be above 60%. So be careful if I've also seen people making, I guess, homemade sanitizer and things like that. Be careful that you're actually doing that it is actually the correct percentage. And if you're worried and want to make something yourself, soap and water.
Okay. Well, Dave Ivanovsky asked, if you've been infected with the virus, then recover, can you become infected again, or are you immune?
So this is the answer to that is you should be immune, and this is what we're seeing. We're using our serological test to measure the antibodies in people that have recovered. And one thing that which has been reported and what we're seeing is there's some cases where people have been, I guess, they're sick again. And I don't believe that these people have actually been infected a second time, but rather that they never really cleared the virus. Perhaps their immune system dealt with the virus quite well and brought the level of the virus down perhaps like beyond, lower than the limit of detection. So it was thought that these people had recovered, but the disease duration is maybe a little bit longer. So a natural infection, in the same way that a vaccine will work, is if you have been infected, your antibodies should protect you from subsequent infections.
All right, Charles Kiriakou asked, and this is something I've thought about too, if we're asked to stay 1.5 metres away from people, but we're encouraged to get out there and support our restaurants and have takeout and eat food that others are preparing for us, is there any risk that the virus is being transmitted through food?
So I would think that the risk of this is low, but it cannot be discounted. So if someone was preparing food, for example, first of all, the person preparing the food would have to be infected and they would have to be shedding the virus, which is a possibility. And if that person prepared food and sneezed and didn't wash their hands and then touched something, even if it's the outside of a container, for example, and then you were to touch that, then yes, you could contract the virus that way. It's not, but it would still have to be, have to, it's not through eating, it's more that you're touching your mouth or your nose with and having contact with that secretion from the person on the food. I think it's highly unlikely, but it's possible.
And Melissa Northey had a question that went to this whole point about fresh veggies and other packaged item boxes that you might be bringing things home from a supermarket with. And this goes to, I guess, common sense again. And there's a question on the screen, but if we want people to wash their hands, well then we'd be saying to them, wouldn't we, wash all your fruit and veggies, wash anything that comes into your house, give it all a good clean, be conscious even of linen and things like that. Anything to do inside the house, I'm told, is things that we should keep up, but we should be doing that anyway.
Yeah, I agree. Like it's, I think I'm a virologist, so I think that some practices I've had for a long time, which maybe other people wouldn't necessarily do. Like I never take a grocery bag from the supermarket and then put that bag onto my bench and then prepare food in the same place. But that's more for like bacteria. So I guess the same sort of things apply. If just wash everything that you can and practice really good hygiene.
Well, that's terrific advice, and thank you for answering all those questions. It's amazing, we are deluged 24/7 with information about coronavirus, but sometimes the devil's in the detail and the practicalities are missing from some of the experts. So I really appreciate your time, Dr. Danielle Anderson.
Thank you.